Good morning. I'm Dr. Bartels, for anyone who doesn't know me, and thank you so much for coming in today to participate in Annual Skills Day. Sean and John have done a great job, and I had some skills that I wanted to go over, but I'm unable to be here in person on all the days, and so I'm giving you this video so that there can be some consistency in the message that you receive. So I'm going to cover 5 different skills. They might seem kind of simple and elementary, but they're really, really important to patient care, to the physicians, and most importantly to our patients. I'm going to start by taking a big step backwards and looking at the jobs that all of us do as being part of a giant theatrical production. When you come to work every day, you are actually like an actor in a giant theater production that you might see on Broadway or someplace like Broadway.
So the reason this is important is because we're going to be talking about both service and quality, and service and quality are intricately linked. The patients don't really know about quality from the same standpoint that we do. But they do know about service. They do know if they were greeted appropriately. They do know if they were treated in a timely fashion, kept informed. So that's why those two things are intricately involved. Starting off by talking about something very near and dear to all of our hearts, and that is the stool. The stool is actually a very important piece of equipment, and I know many nurses are really good about having a stool at the bedside, but having a stool at the bedside on the patient's right side, and the reason that it's the right side is because that's how physicians are taught how to examine patients in medical school, is to be on the patient's right side. It's kind of like mounting a horse or a bicycle. It's always done from the left. That's just the way it's done. So if you have it on the right side, the physician can have the opportunity to sit. And there are lots of studies that show that when the physician is at eye level with the patient's perception of how long the physician spent talking to the patient actually nearly doubles. And that's important because then at the end of the visit, the patient has that trust in the physician, and all those questions that patients sometimes ask at the end of the visit might be taken care of at the beginning of the visit. And again, we are expecting up to 1 million more patients with the Obamacare Affordable Health Care Act. 1 million more patients might be coming through our emergency departments, and so we need to be prepared with efficiencies. We need to be able to turn patients over, clear up the rooms so that the next patient with a serious illness can come back in and we can give them great quality and service that they deserve. The next piece of equipment that I'm going to talk about is the WOW, and that would be the workstation on wheels. I know a lot of nurses are using the WOWs in the rooms, and sometimes there's a little bit of a conflict, and I think we need to be cooperative and work that out. But again, if it can be on the right side of the patient, that way when the physician is sitting talking to the physician can then have access to all of the patient's information at eye level, talking to the patient, and either talk to them with their face to them or turn the computer, allow the patient to see their own x-rays and things like that. So this is a nice service piece. It takes time when the physician has to leave the room and go find a stool. It also causes the patient to lose a little bit of confidence in us, as in why didn't we have the room set up appropriately for them ahead of time. The third piece that I'm going to talk about is urine. And urine tests are really important because they provide a lot of clinical information. Sometimes it's the linchpin to making a diagnosis. And I realize it's not really a fun test to gather from a patient, but it's something that's really, really important and something that also can cause huge time delays. So I'm asking all the nurses to put this on their mental checklist when rooming a patient, is get that urine test early. And that means that when a patient's walking to a room, actually have them walk to the restroom first, or if they're in a wheelchair, have them wheel into the restroom in a wheelchair, or they can have the bedside commode before they get put up onto a gurney, or the bedpan as they're getting into the bed. There are 4 types of patients that will almost always need a urine, and you will do no harm. In fact, you'll get lots and lots of praise for getting the urine early on these 4 patients. Anyone with abdominal pain, anyone with a fever, an elderly patient who is either hypotensive or confused, and anybody with back pain that could be a kidney stone. So those 4 patients are definitely going to need a urine and get it early. Again, if we get that test early, we can turn over that patient, give them very efficient and timely care, and free up the bed for the next patient who might have a serious illness such as a stroke or a heart attack, needing very, very efficient and quick care. So next, I'm going to move on to my 4th concept, and it's going to be the whiteboard. So all of us are familiar with the whiteboard, and the whiteboard is a piece of equipment that allows us to give information to patients. One of the topics on the patient survey is, did your healthcare team keep you informed? And this is a great way to convey that kind of information. So the one thing that I would ask, again, as the patients are being wheeled into the room, is that the information on here that be up to date is all. Accurate date. The physician can write in their name, or if you know the physician who's going to be taking care of the patient, it's perfectly fine for the nurse to do that. Make sure that your name is up there. And then the plan is a really important part that the physician should be filling out. So this also leads to the concept of managing up. Managing up is a business term that is used to help set the expectations for the next person caring for the patient. An example of that might be, if I'm seeing this patient, I write my name up here, and then I get down to introducing Kelly, who's not in the room, but I'm going to say, and your nurse is Kelly. And Kelly is fabulous. She's one of our most compassionate and most smart nurses in our department, and you're going to receive great care from her. Just something really simple like that lets the patient know that I have confidence in Kelly, that I think Kelly's great, and that that piece of information gets put in their brain, their expectations are set, and they're going to be looking for those things in Kelly. And in the end, their overall evaluation is generally higher when that managing up concept is applied. So I'm going to pass the baton on now to Sean and John, who've done a great job with Skills Day, and I thank you for your time and attention to these little details that make a big difference. Thanks.